COVID-19 hospitalisations reached a record high on Monday with 132,646 people hospitalised, surpassing the record by about 600 this time last year. Hospitalisations are overwhelmed because of how contagious it is. And as we've mentioned, more and more are wondering if the numbers focus on those in hospital because of COVID or those who happen to have COVID once they're in hospital. Now, here to talk to us about this all and all the recent COVID news, we have internist at Northwell Health, Dr. Frank Contessessa. Now, welcome back to Wake Up America, Dr. Frank, and thanks for joining us again.
Good morning. Thanks for having me back.
Now, Dr. Frank, it was announced that insurers must now cover 8 at-home COVID testing kits each month. And according to the White House, we should be expecting those free tests to arrive early next week. Now, what is this going to help with? Is this all too late now?
Yeah, it might be. It might be. You know, I think people are over-testing a little bit. I see that a lot with my own patients. People are testing every other day. They're having their kids test every other day. Number one, it's a waste of resources. And number two, it can be clinically confusing. I see often even people with symptoms, they can sometimes come up negative for the first couple of days. And then on day 3 or 4, they turn positive. So I don't think it's terribly clinically useful. If we use these things properly, they can be a little bit useful. But I think it's going to be a little bit too little too late, because by the time these tests arrive, I think the Omicron surge might be well past us.
Now, New York is reportedly showing signs of peaking. How do you expect to see this impact your day-to-day?
Well, I'm still seeing plenty of cases. I think I probably had 5 or 6 positive yesterday. I think we are going to start to peak very soon. You know, the South African data has been clear, and from other parts of the world, that I think in the next couple of weeks, we're going to start to see it plateau and hopefully go down soon.
Now, this is interesting because the Pfizer CEO, Albert Bourla, has said that the Omicron vaccine will be ready in March and that 2 doses aren't enough for Omicron. But what's backing up this statement, and why do we need yet another vaccine when, like we've said before, certain states are already showing signs of a peak and Omicron, as we've already said, is less virulent?
Sure. I think by March, you know, if this vaccine hits us in March, it's going to be like putting up the convertible top after the rain stopped. And I think people are going to get to the point and say, why should I need a vaccine for something either I've already had, or if I do get it, is going to be so mild? It's good news for the elderly and the at-risk. And, you know, I echo this message time and time again, that we have to focus these vaccination resources on the most at-risk populations. But to widely vaccinate people a third and a fourth time for an illness that right now is continuing to show very mild cases. I know you mentioned the hospitalizations going up, but that's just because of the sheer volume of cases. The percentage of hospitalizations hasn't gone up, and the percentage of deaths have not gone up. In some cases, they've gone down. So don't panic when you see these numbers. It's just the sheer volume and the speed that Omicron has overtaken us. So March might be a little too late, and you are definitely going to see vaccine fatigue with people saying, you know what, I'm not doing this anymore. It's a mild illness. I'm not taking any more vaccines. And then there's a question of, is this even good for our immune systems? To continually bombard our immune systems with super targeted immunogenicity and say, listen, we're going to target just this one portion of the virus over and over again, I think that might prove to be a little bit unhealthy.
Absolutely. All right. Thank you, Dr. Frank Contessessa. We appreciate your analysis on this and for joining us once again.
Thanks for having me back.